If you can hear me, please put yes in the chat box. All right, I think we are set to start. You are all welcome to today's writing orientation class. If you can hear me, please drop yes in the chat box. Okay, that's fine. I think okay, I'm getting a response now. Good evening, Dr. Okay, Olukayode and Teniola Ahmed. That's beautiful. I was like, what's going on? Because nobody was responding. I didn't know what was going on. So just give me a minute. Let me try and share the link on the Telegram group, and then we'll be back. I suppose those one asking for the link, perhaps they've not subscribed to my YouTube channel. That's why they are asking for the link. Okay, so we are going to take the review one after. Okay. So I'm receiving a lot of you. Doris said good evening. That's fine. Olukayode, good evening. You are welcome. Um, so let's get started now. We are going to start. Let's see how many doctors are in the house and how many nurses are in the house, so that we'll know where to start from. Okay. So if you are a if you are a nurse in the house, can you drop yes in the chat box? If you are a nurse in the house, please drop yes in the chat box. All right, Nurse Lily, good evening. Okay, Imoru, good evening. Abadi, good evening. Okay, we are all welcome to today's class. So let's get started immediately without wasting time. I think there was a little bit, will I say disconnection or interference, so to say. So let's start now. So I gave you guys a task. Let me project it. We are going to start from the nurses. We review the letters posted on my YouTube channel and on my Facebook page. And then we'll also, what's showing here? We review the letter posted on my Facebook page, and then also the one posted on my Facebook group. So anywhere anywhere you uploaded your letter, whether on the Facebook page or on my Facebook group, both will be they will all be reviewed. But if you posted your letter as anywhere outside these platforms, I don't think I'll be able to see or manage your letter. Yeah. So let's see. Okay, I think this was the letter I gave the nurses. Yeah, this was the letter I gave the nurses. And I suppose by now we would have gone through this case note. Yeah, we would have gone through this case notes by now, because I gave this case note to the nurses. And from the writing task, the writing task says, using information in the case notes, write a referral letter to the social worker outlining all necessary information related to the patient's ongoing care and support. Address this letter to Megan Sims, social worker. It means you are writing this letter to a social worker. Yeah. So in writing this letter while writing this letter, you would really have to put a lot of things into perspective. You are writing to a social worker. A social worker is not medically inclined, so you might not be allowed to use a lot of medical jargons when writing this type of letter, and you should make your point very straightforward for the social worker to understand. If you go through this letter, if you have already gone through this letter, because I don't want to start reading everything in this case note so that we will not waste time. So I suppose if you are here in this platform, that means you would have gone through this case note already. So what you are going to do now, I'm going to project the first letter we are going to review. The first person that posted the letter on the on my page should be let's see, I think it was a Simnashi if I'm not mistaken. Yeah, it was yeah. Yeah, Esim she was the first person to project to upload her letter. So let's take a look at her letter. She uploaded it 3 days ago. So if you can see this right up here, that's fine. So this Esim Nashi's letter, the address well written, the greeting well written, the date also well written, the heading also well written. But remember, while writing, after the greeting, dear Miss Sims, not Sim, I think you misspelled the name. After dear Miss Sims, the next thing you are supposed to leave one line before you write the real line, or what I call the heading. Now, let's see Esimnachi's introduction and see. Esimnachi said, I'm writing regarding Mr. Scott, who was admitted yesterday for suspected. So what we're going to do, we are going to read everything down first, and then we'll go over what Esimnachi wrote. I'm writing regarding Mr. Scott, who was admitted yesterday for suspected fracture following a fall. He's being discharged today and requires assistance with arranging ongoing care and support. On admission, Mr. Scott was intoxicated, uncertain of any head injury when he fell. He is hypertensive, cholesterol level is high, and his weight is above the normal range. Additionally, the lower part of his legs are swollen. For these conditions, he has been prescribed some medications. His condition has, however, improved. He recognizes people's support he recognizing people supports himself with a walker to move. Please note that Mr. Scott loses control of his urine and stool sometimes. Mr. Scott lives in New Town Retirement Home where he has been for 7 years now. He is divorced, has a son who occasionally visits. He is self-reliant, uses his vehicle for short trips. Although he has ceased smoking, he grossly consumes alcohol 8 to 10 every day but has expressed eagerness to reduce it. Given the above information, kindly assist with making adequate arrangements for ongoing care and support Mr. Scott. 3 hours daily assistance with household chores and bathing of his lower legs is recommended. Also, professional counseling for alcohol dependence is required, as well as meal delivery services. It would be appreciated if you could arrange for a dietitian to educate him on his diet. Please do not hesitate to contact me if additional information is required. Now we've read Esimnachi's letter. Letter. Do you think that Esimnachi was able to express herself to the extent that the person, the social worker, will be able to understand the problem on ground, and then what exactly the Esimnachi wants the social worker to do for this patient? If you think these two aspects are very clear in this write-up, drop yes. If you think they are not very clear in this write-up, please drop no. I'm not receiving any comment yet. Okay, Malade Alabi said yes, that she thinks the content of this letter is very clear and that the problem is well identified, and what exactly you want the reader to do, it's also well identified. All right, but let's start from the introduction because she really tried, but I think I reviewed her letter the last time. I think she did, the last one she wrote was clearer than this. But let's go back to her write-up again and see. Now, in the introduction, she said, I'm writing regarding Mr. Scott, who was admitted yesterday for suspected fracture following a fall. He is being discharged today and requires assistance with arranging ongoing care and support. Here, she was able to state the purpose of this letter clearly, that this patient needs ongoing care and support. But the problem she identified why this patient will need ongoing care and support is totally wrong. Yeah? Remember, we are writing a social worker. Why do you think the first thing you have to do, if you actually watched my video on how to identify the purpose of a letter, the first thing you have to do is first to identify the purpose of the letter, which she did here, that this patient will need ongoing care and support. This is the purpose of this letter. Then the next thing you are supposed to ask yourself, why will Mr. Scott need ongoing care and support from this social worker? Now, if the reason is because this patient was suspected of fracture following a fall, I think this is very wrong. This is not correct. And why did Esimnachi pick this? Because of that dogmatic learning that some persons have already learned, that anytime they see a case note, they will just go and be looking for the diagnosis. Here, the diagnosis that was made in this case note is not the problem. It's not the reason why we are referring these patients to see to a social worker, why we are inviting a social worker to help this patient. If you actually went through that case note, you will discover that this man is heavily dependent on alcohol. This man is a 72-year-old man, so he may not be able to take care of himself. That's why you are requesting a social worker to come and help in the ongoing care of this patient and support. It's not because you are suspecting this patient has fracture, or which, if you actually go through that case note, this patient never had any fracture. There was no fracture. Yeah, there was no fracture at all. So bringing that he was admitted yesterday for suspected fracture following a fall, he's being discharged today and requires. So it's not really clear to this social worker why this patient will need ongoing care and support. Okay, so it's the reason you gave there is not very clear. Because at the end, this patient didn't have any fracture, he didn't have any head injury, he only sustained some superficial bruises. So the major challenge or the major problem here is that this patient is heavily dependent on alcohol, he is old and may not be able to take care of himself. That's why we are inviting a social worker. Let's even look at it this way. Even if this patient actually sustained a fracture, is there a social worker that we have to call in this regard? The answer is no. So don't just read the case notes and look for the diagnosis and copy it and paste it in your introduction. Sometimes the diagnosis might not give you the true picture of what is going on. Yeah. Here again, because you are writing a social worker, this social worker will be more interested. I think why she wrote this letter this way, because if you come to this second paragraph, she kind of mixed a lot of information together. On admission, Mr. Scott was intoxicated, uncertain of any head injury when he fell. Here, she has already started discussing the treatment so far, what was done for the patient. She now went up to say he is hypertensive, cholesterol level is high, and his weight is above the normal range, bringing in the background medical condition here. Then he now still went on to say, additionally, the lower part of his legs are swollen. For this condition, he has been prescribed some medication. He went back again. Okay, this is also part of the medical background. His condition has, however, improved. Now, she went on to start telling us how the patient is doing and bringing in the current situation of this patient. So it seems that she kind of mixed up ideas in this paragraph, which is not very nice. And again, this paragraph is not supposed to be the second paragraph, to be honest, in this letter writing. You are writing a social worker, and the issue here is that this patient is heavily dependent on alcohol. He's kind of isolated to some extent because even the next of kin does not even visit. Yeah, so he needs ongoing care and support because he may not be able to take care of himself. So I think the social history supposed to have come as the second paragraph because the more important information come up first. So the social history, the social background is directly linking to this person's problem. So it's supposed to have come as the second paragraph. Yeah, but in terms of your recommendation, you really tried You were able to highlight things that you really want this social worker to do specifically and made your instructions very clear. You tried in this regard. So if will I say if I'm to score you, I'm not yet OET examiner. Okay, so to be honest, if I'm to score this letter, let's assume I'm OET examiner, which I am not. So if I'm to score this letter, I will kind of give this letter something 300. Yeah, I'll give this letter 300. All right, so that's for a Nachi. Let's go to the next write-up on the group and see. All right, the next person to post was Rushida. That's Ololade. Okay, let's go through what she wrote. The address is fine, date is fine, greeting is fine, and the heading also fantastic. So let's go to the introduction. Thank you for seeing Mr. Scott, a diverse, self-reliant resident of a retirement home who was admitted into my care following an incident of fall onto his right hip with suspected fracture, which was however ruled out. He is being referred to you for expert assistance for a period of time while he recuperates. Okay, now I think for Ololade, she actually trying to like bring out the issue that this man is divorced. That means she kind of isolated to some extent. Okay, a resident of a retirement home, well, admitted following an incident of fall onto his right, which was suspected to, but the problem was not really very clear here. Then in terms of the purpose, he's being referred to you for expert assistance for a period of time while he recuperates. Okay, that's fine. But if I were you, I would copy the purpose of the letter the way it was given without paraphrasing the purpose of the letter, so that you will not deviate from the purpose of the letter. The purpose of the letter here is for ongoing care and support. I will copy it that way and use it. Okay, he would need your ongoing care and support. I think that will suffice then. Yeah, Mr. Scott was admitted yesterday for a period of 24 hours with a current stable medical state. While he sustained minor bruises coupled with a likely concussion, which could not be confirmed as he was brought into the hospital in an intoxicated state. Ronald, now this type of thing I would advise you to do. If you are sticking to Mr. Scott, please continue with Mr. Scott. Don't say Mr. Scott, you change again to Ronald. Yeah, Ronald has a history of alcoholism and consumes 8 to 10 glasses of spirit daily. Mr. Scott is a known hypertensive and is morbidly obese with bilateral lower extremity edema cellulitis. He is on oral furosemide. Okay. Presently, Ronald, she's back again to Ronald. Presently, Ronald ambulates independently. We know Ronald and Ronald, Mr. Scott. Ronald Scott is this person's name, but you don't need to be changing it. Just stick to one, right? If you want to call Ronald, just go ahead with Ronald. Eats well and healthy and is willing to reduce alcohol consumption. He has a personal emergency response system which he wears always with response time within 2 minutes. Mr. Scott would benefit from assistance with arranging home care for about 3 hours every day for the next 2 weeks, with particular help with house chores and bathing. Meals could be arranged on wheels and delivered regularly. He would also need a professional counseling for alcohol dependency. I would appreciate if contacted for any concerns or queries. Choose one. Just go for any concerns. No need adding queries again. Yours sincerely, Nurse. All right. So there is this mistake even the first writer and the second writer also made. For me, I really don't see the need of bringing in this medical history here. Now you are telling a social worker that this patient has a bilateral lower extremity edema cellulitis. Do you think that a social worker will understand this medical jargon? Remember, a social worker is not a medical, didn't go to medical school or nursing school. So those medical terms, they are not used to them. So you telling a social worker, telling this reader that this patient has bilateral lower limb cellulitis, and then you even wrote the prescription, furosemide 40 mg twice daily, aspirin 81 mg twice daily. This is not what you should be writing for a social worker. Do you understand? This furosemide, it's you are writing all those doses and the rest. Do you want the social worker to be administering this medication? That's not her job. That's not why you are inviting this social worker. So I feel this whole background, to be honest, I wouldn't, even if I want to write it, I would just state maybe Mr. Scott has some medical conditions like such as high blood pressure and some skin rashes, and he's on regular medications. I will summarize it that way instead of explaining it in details here, which will not make any sense to a social worker. Yeah, I think the same organization that Simnachi followed, you also followed, which is not really very nice. The social history is more important to the social worker here. Should have come as second paragraph. Then you summarize the treatment so far. No need giving details like okay, where you say with a likely conclusion which could not be confirmed as it was brought into the in the emergency. They actually ruled out all those things. There was no conclusion or any chest anything. The only thing that this person had was just mind bruises. So I don't see any need talking about the conclusion and telling the social worker about those details here. Yeah, so it's very important you select just only appropriate information, and then know what a particular person will need. If you are writing a nurse now, this medical background will be very appropriate. If you are writing a doctor, this patient, maybe you are referring this patient to a doctor, these details you gave here will really be very important, but here they are totally irrelevant. All right, so Olalade, you tried, but I really think you have to still work more on your writing. Even the way you organized it, I kind of think all these spaces I'm seeing here, maybe because you copied and paste, this might not be how it will look. Because if it is like this, you wrote this letter on a paper, it's not really nice. Because you're supposed to make your paragraph in very distinct. You leave one line in between each paragraph. Yeah? Okay, let's see what Bernard wrote. Bernard Chapman. All right. Bernard Chapman. Okay, let me be sure that you guys are still following. Okay. All right. Okay. So if you are following, please say yes. If you are lost or have any question, you can always drop your question in the chat box and I will answer your questions one after the other, depending on the one I see on my view. Okay, so let's go back to Chapman. Bernard Chapman. The address were written, dates were written, greeting were written, and heading were written. Let's see the introduction. I'm writing to refer Mr. Scott, a divorcee. After Mr. Scott, there should be a comma. Anyway, I'm not going into details with grammar and all. I just want to go more on how you structure your letter, make the purpose very clear to the reader. Who was admitted for suspected fracture of the hip. He would need ongoing care and support from you. If you can see here, most of you are just like deceived by the diagnosis. Yeah, the diagnosis is not the problem here. They suspected, but there was never a fracture. So why bringing it up in the first place? Do you understand? So don't always go and be looking for the diagnosis to copy. The diagnosis might not be the problem here. As I've said before, this person, the issue here is that this patient is heavily dependent on alcohol. He's kind of old and may not be able to take care of himself. So you are inviting a social worker to support and help and even offers professional counseling. Yeah? So the next paragraph, on admission, Mr. Scott appeared alert and oriented on time, place, and person. This is not correct. Mr. Scott didn't appear alert, oriented in time, place, on admission. On admission, this man was intoxicated. Yeah? So be very careful to understand that case note well and then put it and express it in the way that someone will understand. Don't just try to copy exactly how it is in the case note. Read the chunk of information, understand it, and express it in your own way. Because I think you missed it up here. Because on admission, this man was intoxicated. He ambulates independently with an aid of a walker. He consumes 8 to 10 spirits of alcohol daily. However, he wishes to have a reduction in his intake of alcohol. He was a heavy smoker for 35 years, but has stopped smoking 12 years ago. Yeah, here you kind of started with the current situation, how the patient is Anyway, I think you were a little bit confused, Bernard Chapman, because you said on admission, and then you went ahead to start telling us how the patient is doing now, and then you now went back to start telling us about this patient's social history. So as much as possible, try as much as possible to have one idea in one paragraph. Don't try to clump up your ideas together, because here you are about starting to tell us the treatment so far. You jumped into telling us how the patient is doing now, and then you went back to start telling us about this patient's social history. So like three different ideas um, clumped up together here. Upon discharge, kindly assist Mr. Scott with home care duties 3 times a week lasting for 3 hours. This information you put here, not very clear. Read it clearly. The instruction you are giving to this person is not clear. So try as much as possible to give clear instructions. Don't write it. Don't try to force yourself to write it the way it's in the case note. Do you get? So you've read it. What is actually needed here is that if this patient come, this is the number of hours that at least if this social worker come, at least 3 hours per each visit. I think 3 times a week would be enough to support this patient. Yeah, so make it clear. There should be an arrangement for a professional counseling on his alcohol consumption. Encourage him to eat healthy and avoid the intake of high sodium food. Please refer him for dietitian review when necessary. In view of the above, I hope you would be able to cater for Mr. Scott. I don't really see the need for this in view of the above you wrote here. You've already made your recommendation clear in the paragraph before that. So this line is totally useless here. So just delete it. It's not serving any purpose. So please contact me in case of any queries. Yours sincerely, Charge Nurse. Chapman, your organization is very poor. The purpose of this letter is not that good. It's not even, the purpose of this letter was not well identified. And the clarity of what you tabulated, because the reader didn't really follow through to really understand the situation on ground before now asking the reader to start doing all these things you asked here. So it wasn't really clear because of the way you arranged your own letter. So I wouldn't give this letter a pass. I won't give it up to 300. So let's go to this next write-up. This write-up is from Onyetunji Alimat Oyetola. Okay, so let me be sure that we are still together here. Okay, I think everyone is following up. Okay, that's fine. So let's continue. I just want to make sure that I'm not losing you guys. Yeah. Okay. Oyetola, the address is well written, date well written, greeting well written, heading well written. I think in terms of all of you that have written so far, you guys are very good in writing the address, date, and it's really very fantastic. And this is a very nice way to write it, really. Then in your introduction, I'm writing in respect of Mr. Scott, who is being discharged and requires assistance with home care management. Try as much as possible to state the purpose of the letter the way you are giving. In the case note, they say ongoing care and support. Copy it and paste, especially that purpose of the letter. For other things, you can try to paraphrase, but for the purpose of the letter, just copy and paste, because sometimes you might want to paraphrase and you just miss out on the purpose of the letter. Yeah? And here, you didn't give the reason why this person will need this assistance. So the problem wasn't well identified. I really advise you to go back to my YouTube tutorial on how to write the introduction of both discharge, referral, and transfer letters. Watch that video to know, because there are two things that should be in this your introduction to make the purpose of the letter stand out, which is the problem on ground and what exactly summary of what you want the reader to do for this patient. In your next paragraph, Mr. Scott was admitted following a fall on his right hip with suspected fracture. He was not sure whether he hit his head or not as he was drunk upon his arrival. In spite of this, he may likely had sustained concussion. Now, this information, you are still saying that he may likely to have sustained concussion, but in that case, no, they've cleared it. There was no head injury or any fracture. So this information you are bringing here, it's not in line with what is in the case note. Mr. Scott has been previously diagnosed with hypertension as well as bilateral lower extremity edema, along with venous status hypocholesterolemia. Okay, No, you are saying Venus says, I think it's thesis you wanted to write, hypercholesterolemia, although you didn't spell it very well. A social worker will not, you are making this letter very difficult for the social worker to understand because of this highfalutin medical jargons you are using. Yeah, the social worker does not know this thing you are writing. So whenever you are writing, be careful with your language. Yeah, be careful with your language, the choice of vocabularies and words. Try as much as possible to write more in English than using all this medical jargon. Even when you are writing a doctor or nurse, it's better to express yourself in English. You can explain those things in English better than trying to use medical jargons. But even if you are to use medical jargons, let it be to medical personnel and not people like social workers, patient relative, all those ones that are not really medically inclined. Because here, as a social worker, I'm already confused. He is a non-smoker but quit 12 years ago. Meanwhile, he still consumes alcohol heavily as he drinks spirit 8 to 10 on daily basis. He is divorced and lives alone. Mr. Scott is oriented to three spheres of life. What do you mean by oriented to three spheres of life? Yeah, don't, as much as you try to paraphrase, don't paraphrase things that someone will not understand. If you don't really know how to, there are some things you don't even need to paraphrase. He's oriented in place, time, place, and person. I don't think you really need to paraphrase that. Do you understand? Or you can say he's fully conscious of his environment. Yeah, that's fine. If you don't want to say oriented in time, place, instead of saying he's oriented to three spheres of life, mobilizes with a walking stick. He had x-ray done, results revealed knee fracture sustained. He wishes to minimize alcohol intake. Also, he needs help in carrying out some house chores, particularly bathing the lower limbs, and requires professional counseling for alcohol dependency. Kindly make a schedule to assist Mr. Scott. If you have any question, please contact me. Yours sincerely, Nurse. Yeah, the problem with this, your own letter, number one, the purpose is vague in the introduction and not well really explained in the body of the letter because of the way you organize your work. The social history to me would have made the purpose of the letter clearer by trying to bring up the problem earlier, what the issue with this man, the next of kin, no support, drinks. Yeah, before you just summarize those medical things that happened, the social worker doesn't need all these details, how x-ray was done and all. Yeah, before you now let the social worker know how is this patient doing now, he's oriented in time, place, and person, he can now do this, and finally you make your recommendation. What and what exactly do you want this reader to do for the patient? To be honest, I will not give this writing a pass. I will not give it up to 300. Let's go on with the next person's write-up. That's Shanti Edman Neil Wilson. All right, let me be sure we are still together. Okay. All right, that's fine. So let's go on with Miss Megan Sim. Okay, let's see what she wrote. Shanti. I think after Shanti's case, I think Shanti's own is the last one here. Any other? I don't think there is any other okay remaining because I think I mapped out 40 minutes for nurses and then 40 minutes for doctors. Yeah. Okay. So let's see what Shanti wrote. Address again were written, date were written, greeting were written, and heading were written. So for the date, it's fine the way you wrote your date, but I would suggest you write it the way others have been writing theirs. Writing it, taking this format, yeah, or this format. The format you also use is also very okay, but if you look at most of the ones that the officials usually like present, they usually use this format. So just go with that. Okay, the address were written, date, greeting, and heading fine. In your introduction, I'm writing to refer Mr. Scott, who was after that Mr. Scott, there should always be a comma before you use that who was admitted on this date for possibly having concussion after a fall. He is now due for discharge for your home care management and further evaluation. Well, this is not for any further evaluation. What we just need is ongoing care and support. The purpose of this letter is not clear and the problem also not very clear. There wasn't any conclusion, so why bringing in there was possible conclusion? And even this word conclusion, do you think a social worker understand what this term is? Do you get? So let's take into into perspective. Also, you really have to like consider the person you are that is reading this letter. Yeah, because you make life very difficult for the social worker. The social worker will now go to internet and be searching for conclusions, searching for the terms of this medical. So it makes the clarity of your work to be reduced. As regards the social and medical history, Mr. Scott is a divorcee who is self-dependent and resides in New Port retirement home for 7 years now. You cannot say resides, which is a simple present. I didn't want to correct grammar, but let me just point this out anyway. You cannot say resides and now say for 7 years now. That means the verb tense with the duration or the time range, they are not in agreement. So this is a simple present tense. So you cannot use simple present tense and then come and use a time range, 7 years now. So if you want to use a time range, you would have said and has been residing, maybe a present perfect continuous tense, okay, and has been living in Newport retirement for 7 years. That's what you should have written. He consumes alcohol excessively, especially spirits, about 8 to 10 times a day. Mrs. Scott is obese with basal metabolic index of 50.7, has eczema and inflammation of both lower limbs. Okay, here you tried as much as possible to use terms that at least everybody know what is called obesity. Even a market woman, if you say obesity, eczema, inflammation of both lower limbs, that's fine. You didn't use the hypercholesterolemia, stasis, all those big medical jargons. That's fine. So I really like this, your background, the way you started yours. While under our care, he was placed on some medication to reduce the swelling, treat the skin infection, and to strengthen the bone. It's like you're not bringing in things that are not in that case note. Was there a place that they said the bone need to be straightened, that you did something to straighten the bone? I can't remember seeing this in that case note. Although there are some superficial bruising, which is reddish or deep purple in color on the right hip, he uses walker for ambulatory purpose independently. These two sentences you connected with, although, are they really related? Yeah. Here you're talking about superficial bruises. Now you're talking about using ambulatory, using walker for ambulatory purpose. So I don't think these two are really well connected. However, Mr. Scott is incontinent of bladder and bowel at times and is keen on healthy eating, but ready to discontinue food rich in sodium. In addition, he wishes to instead of saying food rich in sodium, why not say ready to discontinue food rich in salt or salty food. I think that is better, is easier for the social worker to understand. If you say sodium now, social worker will be confused. Yeah. In addition, he wishes to limit his alcohol consumption level and agrees to wear his personal emergency response gadget at all times. In view of the above, I believe Mr. Scott would require home visit 2 times. I don't really see need for this in view of the above. Just go on and start your paragraph that way. I believe Mr. Scott will require home visit 2 times a week for 3 hours duration to enable assistance in household chores, especially bathing of his lower limbs. Please ensure that he receives professional counseling on the need for non-dependence on alcohol. I would also recommend meals on wheel and probably see a dietitian for. I think you did a very nice job, really. Shanti Edman, now this is a very good pass for you for this letter writing, although the purpose wasn't very clear, but I should be able to score this letter 320 here, which is a good pass for you. So the purpose of the letter was very clear, but the way you arrange your work, you really did well, and the clarity, the way you also construct your sentences, make things very clear. Use terms that the social worker will understand, although there were occasional confusions anyway, but you really tried in this your write-up. Please keep it up. Yeah, so this where we'll stop for the nurses. So what I will do now, let me project my own write-up for nurses on this. Yeah, So this is the write-up. So I think the heading, the address, date, greeting, and the real line or heading, all of you did very well there. Then in my introduction, look at my introduction. I write to refer Mr. Ronald Scott, who is heavily dependent on alcohol, and I'm concerned that he may not be able to adequately take care of himself. He would need your ongoing care and support. So I have to bring out the problem here clearly for this reader, that this patient is heavily dependent on alcohol, and my concern is that he may not be able to take care of himself. Yeah, so he will need your ongoing care and support. I copied the purpose the way it is in the case note and used it here without paraphrasing it, so that I will not miss out on the purpose of this letter. After that, what I did next was to move to the background, which is the social history. I think it's important to come up in this regard. He has been living at Newport Retirement Home for 7 years, and his only son rarely visits. He is self-reliant, takes a lot of alcohol, 8 to 10 spirits daily. Mr. Scott, now I'm done bringing in the social history. I'm moving on to summarize the treatment so far, what we've done for this patient, just to let the reader know how this problem has actually affected this patient, this alcohol dependency. Mr. Scott was admitted yesterday due to a fall following alcohol intoxication. Yeah, he sustained some superficial bruises and has been evaluated and treated accordingly. That's the summary of what I did for the patient. So I'm making the problem, connecting the problem, and making it very clear for. In my introduction, I made it clearly this patient is heavily dependent on alcohol. In my background, I made it clearly he takes a lot of alcohol, stated the quantity that he takes daily. Here, I made it very clear that what even brought the patient in the hospital in the first place for me to was because this patient was intoxicated and he fell. But I didn't go on to start talking about we are suspecting he had fracture, suspecting he had concussion. They are not relevant now because it never happened. But what we are sure of that he sustained some superficial bruises and has been evaluated and treated accordingly. Yeah? Then, after the treatment so far, I move on to discuss the patient's current situation here. Yeah? Mr. Scott is alert, oriented in time, place, and person, and he ambulates independently with a walker. His senses are within normal limits, appetite is fair, and has no issue with chewing and swallowing. However, he finds it difficult to control his bladder and bowel at times. So I first of all, while tabulating the current situation, bring in the good things first, and then finally now brought in the negative part that he finds it difficult. So learn to organize your work properly, yeah, so that it will flow logically. Now, after that, this is now my recommendation for this patient. He is very eager to cut down on alcohol. Yeah, he is very eager to cut down on alcohol. I would appreciate your professional counseling, and he would need assistance with household chores, bathing his legs, and arranging his home twice weekly. I would suggest a referral to a dietitian for nutrition education, nutritional education, and as he is willing to eat healthy, in case of any urgent concerns, please note that he has a personal emergency response team. So these two paragraphs are my recommendation for this patient, and I stated them very clearly for this reader to understand. And finally, please contact me if you need further information. Yours sincerely, Nurse. All right, before we go over to the doctors, if you have any question, please ask your questions. All right, Lily say, please, the date, if you use 2nd September 2002 and you write like TOP, this is given like this in the case note. Yeah, it's very fine, Nurse Lily, really. It's very fine. Yeah. In formal writings, most time people want to make things to be uniform, but I don't think the officials, they care about it. So you can actually write your date this way, the way you stated it in the date, and then write the DOB in this other format. It's fine. But if you can make it to be uniform, that's also very fine. Onele Godwin say, I've not reviewed his. Unfortunately, I might not be able to go. Maybe you uploaded it late, because now I really have to also review the doctors. But if I finish the doctors right up on time and there is still time, I will review yours. I promise. All right, that's fine. So for the nurses, if you're happy with this, please can you give me a thumbs up, or you say yes, or just to show that you're happy with this. Yeah, somebody is asking, Dil Vitezo is asking, can the paragraphs be as many as 6? Your paragraph can be as many as 1,000. Well, on a lighter note, to be honest, there is no limitation to the number of paragraphs that you can have in your writing. Just try as much as possible to make your work to be clear by putting one idea in in each paragraph. Unless if one idea is just too very small, you can combine. But try as much as possible to make one paragraph to contain one idea. It makes your letter better. There is no number of paragraph that you are asked, or you are like that is a must, that maybe your paragraph have to be 2, 3, 4, 5, 6. No, it depends on you and your paragraphing. Thank you everyone for your thumbs up. Yeah, all right, that's fine. So let's go over. Okay, someone say, please, how can we get the corrected write-up from you? You cannot get it from me, but you can watch it, because it's live and it will be uploaded. So you can watch it and then make necessary corrections if you want. So I might just go slowly. You just read through. I think I was actually reading it out. So while watching it again, you can just make the necessary corrections that you want. Yeah. Okay, I think that's where it's the this thing ended. So please say something on punctuation. Well, Annie Gloria, I wouldn't be able to say things about everything. If I'm to correct every detail in that case note, we will not leave here today. Okay, so I'm just majoring on the the most important, not, let me not say the most important thing, but the highlight of your writing. Yeah, if you really want to learn more about punctuations, you can go to my YouTube. I've already made tutorial on how you punctuate properly, and even how you write prescriptions too. Yeah, you can see them on all these topics are all there. Just look for them on my YouTube channel and go through them. Yeah. If no title is given, you mustn't give a patient a title. Just write the patient's name like that. His name must, you give a patient a title. All right, that's fine. Okay, without wasting much time again, let's go over to the doctors. Yeah. Let's see how many letters were posted. Okay, so the first person to post, that was 3 days ago. I think there are just three uploads here for doctors. Okay, so let's go with the first person. Yeah, if you are here and you are a doctor, we might not be able to project the case notes now, because I suppose by now you're supposed to have gone through that case note, write this letter before coming for this online review. So if you've not gone through it, um you might not benefit much anyway. So always go to my Facebook group or my Facebook page to get the case note for the review before coming to the class. Go through them. If you can write and upload, fine. If the uploads are not too many, I might review everything. But if there are too many, I'll review as much as I can. I believe everybody will learn from even the little that I'm able to review. So let's see what Ajun or Ahmed wrote. The address were written, dates were written, but I'll prefer you go with the other date format. Greeting fine, and the heading fine. In your introduction, thank you for seeing this patient, a 20-year-old student. After this patient, there should be a comma. I don't want to go into all those punctuations and the rest. There should be a comma before a 20-year-old student, another comma, who was managed for acute exacerbation of asthma. I wonder why you wrote this asthma in capital letter. It should be small letter. Medical conditions are written in small letters. It's only when those medical conditions are named after humans, like Huntington disease, Alzheimer's disease, Wilms tumor, although Down syndrome, that's the one you start with a capital letter. Otherwise, it should be a small letter, unless the medical condition is starting a sentence. He is currently stable. He's being referred to you for allergenic testing. I don't know why you also use capital A again for allergenic testing. Anyway, let me not go into details of your writing and further counseling of possible triggers. Yeah, Ajunwo, you were trying hard to get this. You know you are writing an allergist. Yeah? You are writing an allergist, and the purpose of this letter is for allergenic testing, for the allergist to really know, identify what is happening, why is this person having these attacks. Yeah? Who was managed for acute exacerbation of asthma? Was this patient managed once? No. These patients have been having recurrent, frequent attacks of late. Yeah. So the issue here with this patient in that case note is that the patient have been having recurrent asthmatic attacks. That will make the problem clearer, and it will not support why this person will need an allergist to identify the triggers. Because you are a doctor, you've already managed this asthma, but you are worried that this patient is becoming frequent, is becoming recurrent. So you really want the allergist to identify what is going on so that these triggers can be avoided. So you tried in your introduction, but the problem not well clearly stated. So it's kind of make the purpose of the letter not to stand out. In your next paragraph, Tom initially presented at the surgery with 2 weeks history of breathlessness, which improves with change in position, cough, wheeze, and itchy eyes. His chest X-ray was normal, while his pre and post-bronchial response were deranged. Oral prednisolone and albuterol were prescribed with a follow-up in 4 weeks. Now, this with a follow-up in 4 weeks. Why are you telling the allergist? With a follow-up in 4 weeks. Will that help the allergist to identify the problem here now? Why this person is having recurrent asthmatic attacks? So don't just copy everything in your case notes and put it in your writing. Anything you are bringing in must have a reason why you are bringing it in. Maybe you're trying to let the allergist understand the problem, why this patient is having recurrent asthmatic attack. Let's continue with your write-up. He presented about 2 weeks with a weak history of insomnia and eczema. On examination, his blood pressure was elevated, tachypneic, tachycardia, and oxygen saturation was 88% in room air. ABG were deranged. I don't want to go into grammar, but you're always dragging me into it with your write-up. Here you said tachypneic. His blood pressure was elevated. Okay. On examination, he was tachypneic, tachycardic, if you want to go that way. So that what we call concord in your letter writing. So if you say he was tachypneic, you are not going to say tachycardia, you are not going to say tachycardic, and the blood pressure was elevated with an oxygen saturation of 88% in room air. LBG were deranged. On auscultation of the chest, there were diminished lung sounds bilaterally with expiratory wheeze. On this account, his albuterol inhaler dosage was increased from 2 times daily to 5 to 6 times daily. His oxygen saturation were back to normal. His oxygen saturation was back to normal. Or his oxygen saturations, if you add S, you now say we are back to normal. Tom has a history of childhood asthma with periodic eczema flare-ups. His grandfather, I think you're supposed to say his grandfather is asthmatic, while his younger sister has IgA nephropathy and mother is hypertensive. I don't see the need of this mother hypertensive here. It doesn't help the reader to know why this person is having recurrent asthmatic attacks. Yeah. Tom recently moved into a new apartment with 2 cats and sleeps on the floor with a dusty oat carpet. Possible environmental allergens and proper inhaler usage has been discussed with him. In view of the above, he is being referred to you for allergenic testing and further management. Your organization here, I would really advise go back to my YouTube channel. The other letters on I've written both on how to organize your work, because your organization here is not very good at all. You are writing to an allergist, and the problem is that this person is having recurrent asthmatic attack. The more important thing, the most important things in this information in this your write-up, you brought them down. You are telling an allergist, you want the allergist to identify what may be the problem. And now, you as a doctor, you're already suspecting things that will likely be the problem why this person is having these asthmatic attacks. Look at them here. Number one, this person has a childhood asthma. So it's directly linking to what this person is having, and has been having periodic eczema flare up. Yeah, this is like the background information, even the grandfather being asthmatic. Then, most importantly, Tom recently moved into a new apartment with 2 cats and sleeps on the floor with a dusty and sleep on the floor with a dusty old carpet. That your sentence is it's not very correct. Yeah. So this information from here to this place supposed to be your second paragraph here, because it's directly linking to helping the reader to identify the problem here, which is the recurrent or frequent asthmatic attack. So those parts supposed to have come after the introduction. Before you summarize, you don't really need to give details. Response positive 20%. Those details that we are giving are not really relevant. Just let the reader have the picture of how this thing has affected this patient. And this patient has been missing classes. You never talked about it here. So you have to make the reader see the reason why this issue has to be solved. You didn't bring it in this your letter writing. But overall, I think it's a fair try. Really, you tried. I think you brought us some information. It's just that they are not well organized, and the purpose of the letter not very clear in the introduction. Then coming to your recommendation, in view of the above, it's being referred to you for allergenic testing and further management. You never talk about the environment. They also mentioned it. So I think it's more of environmental management you would have written than saying further management. We are not referring for further management. This patient, this allergist is, we are not referring the patient to for this allergist to manage this patient. We are referring for this allergist to, one, identify what the issue is, what are the triggers, and then counsel this patient on how to manage these triggers and the environment to avoid. So it's not like we are referring for the allergist to be managing the patient. No. So you really have to be, it's clarity of your letter is very important. So you really have to try as much as possible. But it's a fair try. You tried really. So let's go to the next write-up. The next write-up is from Doris. Yeah. Let's see what Doris wrote. So for Doris, your address is fine, but there is no need adding that full stop after Old Town. Yeah, no need for any punctuation. Just write your address. Then after the address, you leave a line. Just anyway, I think because you copied and uploaded, I believe you must, because I can see you left like some lines, but it's not very clear the way you posted it here anyway. The heading also fine. Let's see the introduction. Tom Riddle is being managed for asthma, which has been responding to treatment. I'm referring him to you for allergenic testing, guidance on environmental management. You guys are really missing out on how to make your purpose of the letter very clear in your introduction. Because what you said now, they are not really connecting. You said he's being managed for asthma, which has been responding to treatment. It's really not clear. We are not referring this patient because the asthma is responding to treatment. By the way, this patient has been admitted, I think 2 or 3 times. That kind of recurrent in his own regards. John, so that's why you are worried. So make it clear. If you had even said that Tom Riddle has been admitted severely due to asthmatic attack, I'm really worried. I'm really worried as the cause or the triggers of this of the condition is not known. Could you please help to identify these triggers? The introduction is clearer like that. Okay, don't try to be rigid the way you write your introduction. Try to make the problem very clear and then bring out the purpose of the letter very clear. He has had childhood asthma and his condition is hereditary. Okay. These past weeks, he had complaints of breathlessness, persistent coughing slash wheezing, initially pre and post bronchiolar FEV1 was this and this respectively. The dose of the oral prednisolone 50 milligram daily and albuterol inhaler twice daily were prescribed, which he responded to treatment. Why not just say which he responded to and stop it there instead of adding treatment again? Reduced symptoms progressed 2 weeks after with expiratory wheeze, reduced arterial blood gas, decreased oxygen saturation of 88%. Oxygen was administered and saturation was back to normal. Please note that he moved into a new apartment with two car, dusty old carpet and slept. Let me advise you guys, while writing, don't just try to follow through the way they arrange it for you in the case note. Sometimes it doesn't work that way. You are the one to arrange it. That's why you really have to learn how to organize your work. Number one, in this your writing, the purpose is not very clear. Number two, your description, the way the flow of information is not really connecting very well, and it's not making the reader understand the situation here. And most time when you've missed the purpose of the letter, that's how you write. Yeah, when you miss the purpose of the letter, it becomes very difficult for you to really get it very well. Yeah, so try as much as possible to get the purpose of the letter. Yeah, you get the purpose of the letter, and then it makes work easier for you, because if you're able to identify this problem very well here, that this patient has been having recurrent asthmatic attacks, you are really worried and concerned about it, you want this reader to identify what the triggers or what the allergens might be, then it will not lead you on to start letting the reader know the issues here. So you are suspecting he has allergy. I think the background information, the medical background, her childhood asthma, packing to a new apartment, parents having all those issues and the rest, would have given this reader. You don't have to make the reader to wait, because all those treatment and the rest you were talking about wasn't really giving more information. The information that will make this problem very clearer to the reader, you kind of brought them down here. Can you evaluate his condition in order to minimize his risk and reoccurrence? Here again, what you said here is not really in line with the purpose of this letter. You said his condition, for him to evaluate his condition in order to minimize his risk and occurrence. It's not really very clear. Make your purpose very clear. State it clearly the way it's given. Number one is to let's know what is really going on. What are the triggers? What are the possible? Could it be because he moved into a new apartment? Number two, is it the environment? Yeah. So these are the things because the way it's stated in the case note, you kind of make it clear. These are the things you bring it in your recommendation. Doris, you really have to work on your writing, really. Yeah, you really have to work on your writing. Okay. Then let's see the next write-up by Samuel Olukayode. The address is fine, date is fine, greeting is fine, and heading is fine. Thank you for seeing Mr. Redo, a 20-year-old student whose clinical features and investigations are in keeping with asthma. He is being referred to you for allergenic testing and advice on environmental triggers. The purpose of the letter were stated, but the problem is not well stated. Yeah, it's not well stated, but it's a try, and it's a good try. It's close to the problem, but that's not why. The problem is that you as a doctor managing this patient, you are confused now. You don't know what the problem is. Why this patient having recurrent asthma? You don't know. That's why you are requesting from the allergist to do that job for you. Regarding Mr. Riddle's medical history, family and social history, this is not a sentence, So this is a poor write-up here. Regarding Mr. Riddle medical, family and social history, that's not a sentence. It doesn't have a verb. Okay, so when you say regarding Mr. Medical, family and social history, he has been asthmatic. You continue the sentence, not adding full stop. Okay, has been asthmatic since childhood with occasional eczema. His grandfather is also, I don't know why you use capital for grandfather, also asthmatic. He does not smoke and no known allergy. I think you are the first person to mention this, which is very important. Yeah. And that not smoking again is also a very important important negative here too. On this date, Mr. Ritu presented on account of shortness of breath, cough, wheeze, and itching on both eyes. Shortness of breath. Um, Try as much as possible to avoid this acronym. Yeah. If I were you, instead of saying shortness of breath is relieved by sitting, why not say this is relieved by sitting? Yeah, it kind of link this second to the first one, and it's kind of making you not to repeat vocabularies or what you've stated before. Okay, or you can just say the symptom is relieved, or this okay, the symptom is relieved, yeah, by sitting. So to me, I'm not a fan of these abbreviations, yeah, that you used here. On examination, peak expiratory flow meter revealed an increased FE on post-bronchial, which confirmed the asthma. Therefore, he was prescribed with, you don't say prescribed with. This is wrong. If you use that word prescribed, it doesn't go with any preposition or conjunction. Just say he was prescribed oral prednisolone, albuterol inhaler, Symbicort, and was cancelled. There should be another LED on triggers management. Mr. Riddle presented 2 weeks later complaining of insomnia and eczema all over his body. His vital signs, including oxygen saturation and ABG, were unstable. On checks of auscultation, breath sounds were diminished with expiratory wheeze. Consequently, he was administered with this. I think you kind of dwell so much in what you did for this patient, which to me is not very relevant now to this reader. You would have just summarized all these treatments. Yeah, you spent a lot discussing the less relevant thing than the more relevant thing. Yeah, because I can't see where you talk about this person moving to a new apartment, which are the issues, things causing this problem. Now you dwell so much discussing these things that are not relevant. You should have just summarized instead of giving details of this. Now you've managed the patient is fine, the patient is stable. Now you don't have to start giving details of what you did to this allergist now concerning the management, because your concern is not managing this patient, rather your concern is identifying what the trigger could be. Yeah. So on today he cancelled on inhaler. Considering the above, he would benefit from your expert evaluation and care. You now said again evaluation and care. Yeah, it is actually evaluation and care. Don't just use words anyhow. Use things that will go in line with the purpose of the letter that you are giving. Yeah, two things are very clear there: to identify the purpose of this, to identify the trigger, to evaluate, to investigate, to explore what are the possible causes. These are the terms you're supposed to use. Okay, I would appreciate if you can explore. Okay, so if you can explore this situation to understand what could have caused this. Yeah, so this to me, I feel you try as much as possible, use more of English and explain yourself better than trying to like use will I say recorded vocabularies and just post it just to complete your write-up and move. You might just miss on the purpose of that letter writing. Okay, so that's a try, but to me, I won't give this letter a pass, to be honest. If I'm to score that letter, I will not give that letter up to 350. Yeah, I might give you like 320 on this letter. So let's see how I wrote this. Okay, so this is the address, date, greeting, and the heading. In the introduction, I'm quite concerned about Tom, a student who has been having asthmatic attacks of unknown allergens but currently stable. I'm referring him to you in order to help identify the triggers. In my next paragraph, Tom was diagnosed with asthma as a child and occasionally experiences flares of eczema. He had just moved into a new accommodation with 2 cars and he sleeps on a dusty old carpet. His favorite sport is indoor football. This might also be triggering the asthma. Who knows? Because he's playing football indoors, he's throwing dust and all. Okay, for the past 8 years, Tom has not had any episode of asthma till the first of this month when he complained of breathlessness, persistent cough, wheezing, and itchy eyes. He was managed accordingly, placed on some steroids and inhaler, and was advised on allergen management. He had more severe symptoms affecting his sleep, with eczema flare 2 weeks after. So I want you really to see how I paint the situation to make the reader understand the problem, the gravity of the issue here. He had more severe symptoms affecting his sleep, his eczema, with eczema flare 2 weeks after. The situation was savaged with oxygen administration, and the dose of his medication was increased. So to let the reader know that this is really very serious. That was why the dose of this was increased. I'm really worried about Tom as he has been missing classes due to the recurrent acute attacks. I have discussed how he can use the inhalers properly. However, I would appreciate if you can further investigate the precipitating factors and guide him on environmental management. Please contact me if you need more information. Yours sincerely, Dr. The word count here is 193. Yeah. So if you have any questions, so that is how I wrote this letter. If you can see, after the introduction, I moved on to the background information to discuss it. And then after that, I now discuss the treatment so far. Yeah. I now discuss the treatment so far. Then I now still went on to this part of the treatment so far, so to say. Then, and finally, I made my recommendation. Yeah. So, for my recommendation, I kind of still make it, bring in a reason for the reader to see from that introduction going down. You will see how I'm just painting it for the reader to see the need to really identify these patient triggers and properly advise. So the flow of your information is really very important in your letter writing. So I think we've already used over 1 hour. Okay. So at this point, if you have any questions, please drop your question in the chat box. Yeah, thank you, Adegboye. Thank you, Gloria Ifoma. If you have any question, please ask your questions. All right, so I think I'm already exhausted. At this, where I think we can come to the end of this review class. Always watch out for announcements on all my channels, YouTube, Facebook. If you're my Telegram group, fine, but mostly Facebook and my YouTube channel to know when next we can have the next class. It might be listening, it might be speaking, it might be writing. So I'll try as much as possible to help you guys to pass this exam once. I wish you guys the very best, and those of you that the exams are very near, I really wish you guys the very best. Thank you very much, and I really appreciate you coming together and all your thanks. Bye bye, bye bye, bye bye, bye bye, bye bye, bye.